Good evening. Welcome to Fresh Natural Live. It's Monday evening, and we have a great show lined up for you tonight. As a cardiologist, we deal with patients with heart disease. Many of them come in with acute flare-ups of existing heart disease. And, oftentimes we're, having to struggle between what's the underlying cause. Someone comes in with chest discomfort. The question comes up, are you having a heart attack? Are you having decompensated heart failure? And frequently we admit them to the hospital with lots of symptoms of shortness of breath, chest discomfort. What I wanted to do is share with you today is an underlying mechanism. We're going to talk a lot about inflammation of the heart. And that's an important concept because inflammation, as well as its near cousin, oxidative stress, are really frequent underlying contributors to acute illnesses of any kind. We're going to focus on heart disease today and how inflammation can be contributing to your heart dysfunction. Now, many people have underlying inflammation and they don't know about it. So we're going to talk about underlying mechanisms and we're going to talk about natural ways of either preventing inflammation of the heart or reversing it. So stay tuned. We have a great show for you tonight in just a minute. Okay, welcome back. And we're going to jump into a wonderful show we have for you tonight. I'm going to first welcome a friend and colleague of mine, Dr. Celeste Palmer. Dr. Palmer, how's it going?
It's good.
We're going to talk about inflammation in the heart. I know y'all deal with this in the pediatric world, especially since, people have been taking vacations. I won't go any further than that. People taking special vacations.
Yeah.
And young boys who take special vacations can get inflammation of the heart, and we call it pericarditis. But inflammation can affect the whole body in different mechanisms, and we're going to focus on inflammation in the heart. So I'm going to jump into it. Have you seen any young boys with inflammation of the heart in your practice recently? Do you get that much?
I've seen one.
Mm-hmm.
And it was kind of when I followed through the charts to kind of see what the ultimate diagnosis was, it was diagnosis of post-viral.
Okay.
Yeah.
Post-viral. And viral infection, any infection can trigger inflammation of the heart. So that's certainly, and we frequently see it with, viral infections. Many people know about strep throat. That's a described mechanism where somebody as a youth gets strep throat, and over time you can get inflammation of the heart, you get inflammation of the pericardium, you have inflammation of the valves, so you can have pericarditis, you can have valve disease. Many individuals may have to have valve replacement in their 40s or 50s due to strep throat, and so there's a long sequelae of inflammation. We'll talk about some of those mechanisms. Today, I'm going to focus on inflammation of the heart and one of its close cousins, oxidative stress. And I'm going to examine a patient that we treated in our practice who had an acute decompensation. And we're going to talk about how we managed her case using nutrition. And we'll look at some of our research. And I want to just kind of discuss this whole concept of inflammation of the heart and some of the mechanisms. I'm giving a slight warning. It's going to be a little technical, so there'll be some technical terminology used up front, but I'm going to break it down for you. There'll be a little bit of details on the clinical case. I'll break it down for you. But the key, I try not to hide too much of the technical stuff, while at the same time, I try not to, overwhelm you with it. But I want you to get your arms around it and understand this clinical process. So the more you understand, the better you can deal with it. So let's just jump into my little slide presentation here. let me see if this presentation goes well. So inflammation and heart failure. Inflammation can cause heart attacks, heart failure, pericarditis, a lot of different cardiac disease. You can have severe hypertension, which you have hypertensive heart disease. That could be due to acute inflammation, not of the heart only by itself, but the whole cardiovascular system. So I'm going to talk about it from the perspective of chronic disease. Chronic disease is oftentimes what we sort of walk around with, and then we can have flare-ups of chronic disease. So that's like if you have an existing heart condition, maybe you have a history of coronary disease or a history of heart failure or hypertension, and then for some reason out of the blue, you get acutely ill. Maybe you have acute chest pain, shortness of breath, you start to swell up. That's a flare-up. And so you have chronic, then an acute flare-up of the chronic condition. So we'll talk about some of those mechanisms, the underlying causes. So first and foremost, I want to get some definitions out of the way. Chronic disease in general is any adverse condition that's expected to last for more than a year. Pretty simple. If you have high blood pressure, you had it for more than a year, or heart disease or whatever, it's expected to last a year. And these are just common disease that we know about: heart disease, cancer, diabetes, chronic lung disease, arthritis, chronic infection. I can go on and on and on with the list. The thing is that I don't like to think of diseases from the standpoint of the label, not from the standpoint of using the label only. What I like to do is I like to describe it from a label standpoint. Say, well, you have a condition that we commonly know of as chronic, obstructive lung disease, or heart failure, or hypertensive heart disease. But that's just kind of an overview. What's more important for me from the standpoint of helping the patient manage it or treating it is to think about the underlying process. And so we're going to talk about two underlying processes. There's probably a third that's important for chronic illnesses. We won't talk about too much, but I'll just mention it. The first of which is inflammation, which is a critical underlying cause. And inflammation can be thought of as a biochemical fire. So you have this biochemical fire that's underlying, and this biochemical fire could be a process that's underlying and contributing to your heart condition on a regular basis without you knowing. So it may contribute to high blood pressure. It can maybe contribute to weakening of the heart. It may be contributing to the stiffness of the heart, arrhythmias, and you may not have symptoms early on. But it can contribute to other diseases, cancer, neurological diseases, pulmonary diseases, and the like. So chronic inflammation contributes to chronic illnesses in general. It's an underlying process that builds over time, and you can go about your life feeling well or thinking you're feeling well, and the next thing you know, you have a diagnosis because this inflammation fills in. Real quick, I'm going to take a brief pause. Those of you, if you get a chance, hit the thumbs up button, thumbs up, thumbs up, thumbs up. Hit the like button if you enjoy what you're seeing. Let everybody do that right now. That helps the algorithm send this important information out to other people. Also, if you haven't had a chance to subscribe, please do so. You'll get more information from this channel, and share this information with any friends, loved ones, or anyone you think would benefit from this information. So the other component I want to mention briefly, even though we're talking primarily about inflammation, is this condition known as oxidative stress. If any of you have bitten into an apple and see it turn brown and kind of decay before your eyes, that's oxidative stress that you can see. Normal cell can undergo the same type of process where here's a healthy looking cell and then it starts to break down. Free radicals, molecules that we refer to as free radicals, can attack the cell. It can attack cells, it can attack the cell membrane, the DNA, and have lots of adverse effects. And this progressively leads to the cell, the tissue, and then the organ weakening and dysfunctioning over time. And so you have this molecule, we call it a free radical, that's just a medical term, and it's an unstable molecule. So if you think about unstable molecules, radioactive molecules are like unstable molecules. So it behaves like a pseudo radioactive molecule, And these molecules, if they go unchecked, they just bounce around your body, causing damage to cells, causing damage to tissue, and weakening your organs over time. Again, these things happen without your feeling symptoms. So it may be causing damage such that you're developing cancer. It has an adverse effect on the immune system. It may be causing damage to weakening your heart, or stiffening your blood vessels, stiffening your heart. And we'll talk about some of the mechanisms in just a minute. The way you can stabilize these free radicals is use of antioxidants. And antioxidants are things like leafy green vegetables and the like. So when you do a detox and you're nourishing your body with leafy green vegetables, you're consuming these antioxidants, and they're going in and stabilizing a lot of these free radical molecules that's floating around, and it stabilizes them, so it prevents them from causing damage. And then a third component, which I won't have a slide on, just to mention briefly, is the microbiome. And I'll probably do a talk about the microbiome itself, but just suffice it to say that your underlying microbiome is your body's ecosystem. It's microbes, be it bacteria, viruses, fungi that live in and around you. And they play important roles in metabolism, enhancing immune system. They can help decrease inflammation and the like. So the microbiome, which can become abnormal in a poor lifestyle, can be normalized with optimal nutrition and optimal lifestyle. So acute and chronic illness. So let's think about the acute flare-up of inflammation. So here we're going to throw a few technical things at you. Bear with me. I'm going to break all of this down. Inflammation in the setting of acute cardiac injury. So this is where you can have acute inflammation that affects the heart muscle and heart tissue itself, and the heart can become weak and stiff. What are some of the underlying mechanisms? So the pathogenesis, or abnormal pathological process that can lead to heart failure, have different mechanisms. First, they can include pro-inflammatory cytokines. Cytokines are just a fancy term for molecules that are released to signal other inflammatory cells to come in, and these inflammatory cells can do a lot of damage at the tissue site. So if you have some initial inflammatory cells that are caused to the heart muscle because of abnormal chemical signals coming from the heart muscle cells, then these inflammatory cells will then go there. They'll sound alarm and signal other inflammatory cells using these cytokine molecules that come from different parts of the immune system, the spleen, adipose tissue, and the like, and it causes further amplification of the inflammation. There's some cytokine molecules, IL-1 beta, TNF alpha. The names are not so important, other than the fact that we are able to measure certain cytokine molecules, and we can detect in your blood if you're having increased inflammation related to these cytokines. And when I show you some of the data we're looking at, some of these names may be important. The important part is that it can weaken the heart, causing systolic dysfunction, and stiffen the heart, causing diastolic dysfunction. So, so acute heart failure can be a cytokine storm of the cardiovascular system. Many of you may be familiar with the phrase cytokine storm, because that was used a lot when you're talking about coronavirus infection. Many of these people go in, they get the infection, and they have this systemic inflammatory response. Their lungs would white out. They have to be intubated. They get sick. They have blood clots forming and clots forming everywhere. That's a cytokine storm. What is that? That's diffuse inflammation and oxidative stress building up all throughout the body, causing increased clotting, causing inflammation in the lungs. In that case, where the lungs white out, many of these people had heart attacks and strokes. Again, inflammation, a cytokine storm in the cardiovascular system. Many of these people had heart failure that developed, even in the setting of COVID infection, and sometimes with setting in other treatments for the COVID infection. So cytokine storms is not specific to COVID. It's actually related to lots of different acute and chronic illnesses that we deal with. Now, if you look at inflammation in the blood vessels, we look at the endothelial cells. Endothelium is the inner lining of the blood vessels. And so you basically have inflammation in these endothelial cells, as microvascular endothelial cells, and it can have a lot of effects. Endothelial cells are important for the production of a molecule called nitric oxide. And so nitric oxide generation is decreased. We want more nitric oxide, not less. And so inflammation affecting endothelial cells can decrease nitric oxide. And so this has some important effects. One, it can have an effect on this giant cytoskeletal protein called titin. tighten. This protein can lose phosphorus bonds, become hypophosphorylated. That's just a fancy term related to the chemical abnormality of this protein, and it leads to stiffness in the cardiomyocyte. So this cytoskeleton model, think of it as the frame around your house. So this is the frame around the heart. And this frame around the heart needs to be pliable. It has to have some flexibility. But if you have decreased nitric oxide, this frame around the heart is no longer pliable or flexible. It becomes less flexible. And so the frame around the heart becomes stiff. And so the heart itself becomes stiff. The other thing that happens with decreased nitric oxide production is there's a molecule or enzyme called protein kinase G. Again, the name's not important, but the important thing to know is that it causes thickening of the heart muscle cells. We call it hypertrophy, and it makes the stiffness or diastolic dysfunction more worse. The problem with a stiff heart, if the heart is stiff, the heart needs to be flexible like a balloon, just like you inflate a balloon with air. The body needs to inflate the heart left ventricle chamber with blood. If the heart is stiff and it can't dilate, when blood tries to fill that chamber, it doesn't fill up. And so less blood goes in, less blood to come out. So a stiff heart can lead to heart failure. And that's one of the mechanisms that you have with inflammation. Endothelial inflammation causes a range of other effects, VCAM, E-selectin. These, again, fancy names, but what they mean is that these are molecules that trigger further inflammation that can cause this fibrosis and scarring. It can cause this abnormal microvascular dilatation, meaning that your very tiny microscopic blood vessels don't open up. These tiny blood vessels that are important for delivering oxygen to the muscle cells that allow them to function normally. Remember, all cells need oxygen and blood flow to function. And so if you cut off the blood flow to the oxygen and blood flow to the cell itself, then the cells start to suffocate and they start to create abnormal proteins and other abnormal molecules. They create more acid. And so you develop more problems that can have systemic effects. So fibroblasts and myofibroblasts, these are cells that causes more inflammation. So if you see you have this nitric oxide reduction and you would cause, stiffening through cytoskeletal stiffening, you cause thickening of the heart muscle, more stiffening, then you cut off the blood flow and you cause more scarring. That stiffens, weakens the heart, and it takes away from the ability of the heart to circulate and takes away from the ability of the heart to work. So what happens is that you get progressively shorter breath. So what you feel as a patient, when these little biochemical things are happening, your heart's a little bit stiff, circulation goes down, it takes you a little bit longer to walk to the bathroom. You get a little bit more shorter breath when you walk to the bathroom. You have more chest discomfort or shortness of breath when you try to lift things that you normally are able to lift, but you can't. The innate immune system, again, we talk a lot about the immune system for coronavirus infection, but the immune system is also associated with acute flare-ups of heart disease. And I'm not going to cover a lot of these details too much, but TLR4, it's a signaling molecule that appears on the cells of heart cells, but these signaling molecules occur in any cell. There are two different types of signaling molecules that are important. One's called a DAMP, the other's called a PAMP. A DAMP cell, the cell has intrinsic weakening. So the cell says, I'm dying and suffocating. It shows a little signal, a flag. It waves on the surface saying, I'm sick. The immune system recognizes that and goes and destroys that cell. Another cell may be captured by a viral infection or a bacterial infection. It says, it waves another flag. We call that a PAMP. It's a signaling molecule. It tells the immune system, hey, I'm being taken over by a virus or bacteria. And so that signals more inflammatory reaction and goes and attacks those cells. Sometimes you get false signaling, so false DAMPs and false PAMPs, so it can cause a false acceleration of the inflammatory process. Stressors such as ischemia. Ischemia, again, is a lack of blood flow, a lack of oxygen. So that means the tissue is not getting oxygen. It can cause a release of these DAMPs. These are the signals for intrinsic cellular failure, because when the cell's not getting oxygen, guess what happens? It starts to deplete. The mitochondria doesn't work well, and all the other organelles don't work well. The cell gets sick and it starts to die, and it waves its flag saying, hey, I'm getting sick, I'm going to die. So low blood flow, ischemia, low oxygen supply, ischemia, to the tissue causes the cells to start to suffocate. When they suffocate, they say, hey, I'm suffocating. It's through this molecule called a DAMP. And that damp causes more inflammation and can actually worsen the problem that you're trying to deal with. So the last technical component we deal with is this thing called oxidative stress. Remember, I said oxidative stress is a buildup of toxic chemicals in the body. We call them free radicals. The name is not important, but just remember that oxidative stress equals increased toxic chemicals in the body. We've got to neutralize these toxic chemicals. We do it with raw fruits and vegetables and other things that antioxidize the body. So if we don't neutralize them, we have increased oxidative stress. There are 4 things I want to mention with the increased oxidative stress. One is the electrical part of the heart. This is a lot of words here, but it causes a calcium influx into the cells. And the reason I gave you these details is some of you may be medically inclined, so I want to give you enough detail to chew on. And those who are not medically inclined, I'm going to summarize it for you. So that's why I gave a lot of these details. The increased oxidative stress results in increased calcium inside the heart muscle cells. Increased calcium causes heart arrhythmias. In the upper chambers, it can cause arrhythmias such as atrial fibrillation. You're familiar with that. In the lower chamber, it causes ventricular arrhythmias like ventricular tachycardia. So oftentimes when patients are ill, they have inflammation, increased oxidative stress, they may go into arrhythmias. Well, what do we do in medicine? Well, we treat them with antiarrhythmic drugs. Well, antiarrhythmic drugs can be helpful, but we're not treating the underlying process, which is oxidative stress and inflammation at the cellular level. So in theory, there should be a way you can treat this using therapies, i.e. raw food, that reduces oxidation, reduces inflammation, and therefore reverses these arrhythmias and other things. And we'll talk about that when we discuss our case presentation. Number 2, increase oxidative stress, again, by increasing more calcium influx through another kind of molecule. I'm not going to discuss the detail. It's a ranitidine receptor 2 molecule. Name's not important, but when we increase calcium in, it inhibits sarcoplasmic reticulum function through another receptor. In summary, it leads to a weakening and stiffening of the heart muscle. We call that contractile dysfunction. But the important thing, the electrical problems can go abnormal. The heart can be further weakened and stiffened when you have that. The next thing, mitochondria react to ischemic injury by producing increased level of reactive oxygen species. Reactive oxygen species are another fancy term for more chemicals. And so, again, that furthers the first 2 processes when you're not getting enough blood flow to the mitochondria. Mitochondria, the organelles inside any cell that produces a molecule called ATP. ATP is the energy currency. So just think of the mitochondria, among other things, being your ATM machines. So if you need more energy, just like you need money to go to the store, you go to the ATM machine and get cash. The cell needs ATP or energy to do its job. It goes to its mitochondria, the ATP machine, ATM machines for energy. But if that ATM machine is dysfunctional or out of order, then the cell doesn't get its energy and the cell can't do its work. So number 4, the increase in these reactive oxygen species causes scarring, called fibrosis. So there are 4 basic things. Again, in summary, number 1, electrical problems, atrial fibrillation, ventricular arrhythmias. Number 2, heart weakening, heart muscle problems, weakening or stiffening of the heart muscle and contraction. Number 3, inflammation due to mitochondrial dysfunction and poor energy metabolism. And number 4, fibrosis. Those are the things that you get when you have increased oxidative stress. Now, why did I go through all the details? I want to give you a feel for what's happening at the cellular level. I apologize if this is too technical for everyone. I hope you're able to get screenshots of that. You can go back to this video, get screenshots, and look at some of these mechanisms. But the point is, get a feel for what's happening at the underlying level, because when we discuss this patient, I'm going to talk through some of the things that was going on with the patient clinically, and I'm going to try to map you to what I talked about biochemically. So, overview and initial hospital presentation. This is a patient who came to us, she's a 66-year-old lady with congestive heart failure. She had long-standing heart failure. She had a leaking mitral valve. We call that mitral regurgitation. And this IVCD means she had an abnormal electrical conduction in the heart that predisposed to the heart contracting asynchronously. The right and left ventricle don't contract timely, and we call it interventricular conduction delay. The point is that she had an abnormal electrical problem with the heart and a very severe leaking valve. So her condition started worsening. Now, this patient was eating a plant-based diet, was kind of eating some plant-based junk food, and her condition worsened, which appeared to make her mitral regurgitation worse. And we saw her in the office, she was, more short of breath, and she was having some arrhythmias. This patient also had a history of lupus, and so the concern is that was she having a lupus flare that was triggering all of these problems as well. Lupus is an autoimmune disease, and it triggers systemic inflammation. So you have inflammation from another source that can then cause inflammation in the cardiovascular system. So this is a concern we have. Let's take a look at an echocardiogram. I'm going to give you orientation. This is the left atrium, the left upper chamber. This is the left ventricle. This is the aortic outflow tract, but it's kind of a skewed picture there. And so the left ventricle is kind of all of this, but you got papillary muscles and things here, so it makes it look like the two chambers. The right ventricle is here. I want you to focus on this area here. When I play the video, you're going to see lots of blood going back here, and I'll try to pause it in a timely fashion here. So you go here. Okay, I'm going to bring it back. Okay, now this is the mitral valve. This is all the left ventricle that you saw, the papillary muscle and the apparatus from this valve come across here. But you have the left ventricle here. This is the aortic root. So blood is supposed to come from here to here. And then when the left ventricle contracts, this valve is supposed to close. And instead of the blood going here, it's supposed to all go here. Now you see some blood going here, and I can tell by the blue, some of the red going through, but you got a lot of blood going here. Too much is going here. That's going backwards. See, this is forwards and this is backwards. So blood should go from number one, from here to there. But when this contracts, instead of all of it going here, you got a lot going there. I'm going to come back here and play it again. So it's supposed to go from here to here, out here, but you're going to see a lot going there. You're going to see a large mosaic blue-green there. There, you see that? A lot going there. That's the wrong direction. That's mitral regurgitation. Now, I'll let it play through. Here, left atrium, left ventricle, the right ventricle. This is actually dilated. This is really large. This is almost as big as that. This is a little bit fluid around the heart, the posterior part of the left ventricle there. That shouldn't be there. So that's inflammation of the heart.
I have a question, Les. So what, you might be getting to this, but what is her ejection fraction if she is?
Yeah, so the ejection fraction, looking here, it's probably about 20%, 20-25%. You're looking at other, so it's pretty low. And in the setting, and a large percentage of that is going backwards. So it's even worse. You got a low ejection fraction with a good part going backwards. So the cardiac output is going to be very poor. But good question. And so we see the heart very weak. Now this shows the tricuspid regurg there, which is a certain amount. And here's the heart on the short axis. It's a little bit thickened down here. And you see it normally should be squeezing in almost completely. But it squeezes in just kind of in a minute fashion there. And that's the aortic valve there. And so here's another view of it. I'm going to go through this quickly, it's a little close up. And this valve is kind of tattered there. And there's a lot of inflammation in this valve. It's hard to see very well, but it doesn't completely close very tightly. In this view, it looks like it's closed, but if you look at a three-dimensional aspect of this valve, you see that it's not closing all the way. And you see in this, if you look at this part here, the ejection fraction, look, this should be thickening. See how? So this wall here and this wall, they should come together, closer together in the center. Okay, so that should squeeze down to here. This should squeeze up to there. And let's just see, it's barely thickening. See how this is barely thick? This should be thickening like this. This piece should come in like here. And this should come up like here. It's barely moving. You see that? And so that's congestive heart failure with a severe leaking mitral valve. This is the mitral valve, the aortic valve, and most of the blood goes back here and not so much there. So